These are challenging times for America, for our families, our workers, and our businesses. The double blow of a serious recession and a crisis in financial markets has undermined the profitability of American companies and threatened the incomes of America's working families. Our values and character as a nation will be revealed in how we meet these challenges. Today, with the economy struggling to gain traction, policies like paid sick days and family leave insurance are more important than ever. Especially during a recession, losing a job can be catastrophic. Paid sick days and family leave insurance are effective job retention strategies that help workers and, at the same time, enable businesses to realize net savings when the lower cost of reduced turnover and sick days and presenteeism, which is coming to work sick, are balanced against the cost of absenteeism. Most families, as you've heard, face a situation in which just about every available adult is in the paid workforce. Paid sick days and family leave insurance let everyone who works for pay be good family members and good employees. Research shows, and families know, that the lack of paid time off to care for yourself, your children, or other family members compromises health outcomes. The American people get it. Polling data show that the public overwhelmingly supports both paid sick days and family leave insurance. A recent national poll found that 89% of voters, 83% of Republicans, and 94% of Democrats favor paid sick days as a basic employment standard. A poll of New Jersey residents prior to passage of the state's family leave insurance program found that 78% of all residents, including a majority of Republicans, favored that policy. While the benefits to families and to public health may be familiar to many people, the benefits to businesses are less well known. Access to paid sick days and to family leave insurance increases employee productivity and reduces turnover. Turnover is very costly for employers, and access to paid time to care for yourself or a family member significantly improves retention and reduces these costs. An analysis of the 2003 survey of California establishments found that relatively few employees go on leave at any time. On average, 6.3% of workers took family or medical leave in a one-year period, 8% in those companies that had more generous benefits than were required by law. However, what we also found is that 88% of workers returned to their previous employer if there were more generous leave benefits. And in particular, small businesses with more generous leave benefits found that 95.4% of leave takers returned to their job. A cost-benefit analysis in California showed very high savings for both employers and for state government when people don't go on welfare or TANF or food stamps. So both employers and the state benefited. In Massachusetts, a cost-benefit analysis found that while it's true that employers would pay $218 million annually as a group as a result of paid sick days, the benefits, mainly from reduction in turnover, but also from preventing the rest of the staff from getting sick and so on, led to a savings of $348 million annually. The weekly per worker cost of paid sick days would be $1.49, while savings per worker would be $2.38, for net savings to employers of 89 cents per employee per week. And this includes benefits that would have to be paid. Employers are often concerned that providing employees with paid sick days or family leave insurance will lead to skyrocketing employee absences. The data suggests that this fear is unfounded. Now, while it's true that many businesses offer their employees paid sick days, what we know is that these benefits apply mainly to full-time workers and mainly to the higher paid workforce. 71% of full-time workers have paid sick days, only 27% of part-time workers, and access is very uneven, with those making $15 an hour or less very unlikely to have access to paid sick days. If we turn to family leave insurance, we see that California and New Jersey are the first states to implement it. Washington State has passed it but has not yet implemented. In both of these states, The benefit is the insurance premiums are fully paid by the employees. They pay into a state insurance fund. When they require a family leave, they are able to take the time off. I think it is unreasonable. I'm sure there are some good employers who do provide extensive family leave benefits, but it's unreasonable to ask employers to be able to do that. A state insurance fund is the way to go. And in the 2 states, there are no new mandates on employers, only that if your kid gets hit by a car, your mother has a stroke, you need to take a few weeks off, you can collect. In the question, I see I'm out of time, so in the question and answer, I'm happy to talk a little bit about how we can look at family leave insurance and especially paid sick days in the current environment. I have some ideas of how to help employers. I'll just conclude by saying that difficult economic times like the present are the worst times for people to lose a job. And in addition, employers won't hire somebody to replace that person. Family leave insurance and paid sick days enable workers to maintain a stable stream of income and underpins consumption when workers must miss work. Thank you very much.